So this concept of integrated healthcare is a win for everybody, and this is what we're going to see over the next handful of years. You're going to see more and more talk about integration.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.
The biggest change that's happening in our industry right now is this concept of recognizing that mental health and behavioral health and physical health all have to be addressed together. That we can no longer separate someone's physical wellness with their behavioral health wellness or their mental health wellness or their addiction issues. And this is a big trend now. And if you think about this, what we're doing here at Meridian, and this started a number of years ago, we recognized a couple of things. The Surgeon General of the United States came out and talked about disease as being, a brain disease. Addiction as being a brain disease. And we know that it's a lifelong illness, and yet we're forced to treat it in very short-term increments. So what ends up happening is you treat people for their addiction, and you send them on their way. You might see them for 30 days or 45 days. So you know that this is a lifetime disease. You only get to see them for 35, 40 days, and you send them on their way with the idea of, relapse oftentimes is a part of the recovery process. So when they relapse, we'll bring them in, we'll talk to them about what triggered the relapse, what can they learn from that relapse, how can they be stronger in their recovery because they had that relapse, and we re-engage them. But we started thinking about that and said, this doesn't make any sense because we treat people short term, we send them on their way. What if they don't have safe housing? They don't have a job. They don't have an education. They have physical health issues that have not been taken care of. They've lost relationships with their families. Maybe they even had an arrest while they were using that they have to deal with, the criminal justice system. If we don't spend time also helping them deal with all of those things, we've increased their chances of relapse. Because every one of those things can trigger relapse. So what we're trying to do now is truly integrate care so that when we treat somebody for addiction, we're also investing a lot of time and effort in those recovery support services. What we're finding from this integrated approach, it's a win for everybody because the patients are getting healthier. And that's what it's all about. The insurance companies now, when we're treating people for anxiety or depression, they're also wanting to know, are we taking care of their blood pressure? Are we taking care of all the other issues, physical issues that they might have? So the patients are getting healthier. Secondly, the patients are going to save money because their healthcare costs are going to go down because they're healthier. There's less claims. We're benefiting because we are now, for the first time in the addiction field, we're able to have long-term relationships with our patients because now they're staying with us on the primary care side. And so maybe they've been clean for 2 years and they run up against a problem at work or they're having a problem at home and they start to stress out a little bit. We can, with our trained physicians, say, hey, you know what, maybe we need to have you go talk to the counselor again. You want to do that. And we can work with that patient before they hit rock bottom, before they relapse. We can help them navigate through that time that they're in and the struggles that they're having. So this concept of integrated healthcare is a win for everybody, and this is what we're going to see over the next handful of years. You're going to see more and more talk about integration.
BusinessJournalDaily.com 3 Minutes With is brought to you by Farmers National Bank.
I like a bank that's a pillar in my community.
I like a bank so cutting edge, they have a lab branch.
We are so alike.
Well, we do both bank at Farmers National Bank.
Farmers.
Stand strong.